When you ask about Chelsie Falk,
She's always been a very hard worker.
She's just done an amazing job.
people have a lot to say.
She's always willing to jump in and help out wherever and whenever anything is needed to be done.
Falk is the senior director at Sanford Wheaton Medical Center, and she truly does it all.
She's just a good role model.
Along with her leadership role in charge of the nursing staff in Wheaton, Falk also works as an EMT on the town ambulance, is the co-lead of a community food program, and she still handles patient care when needed, even if it's in the middle of the night.
At 3 o'clock in the morning, if they can't get an IV or there's a trauma coming in or a chest pain coming in and they think they need extra hands on deck, I live a block away, so I'll pop on over.
Chelsie Falk's career as a nurse began in high school, but really it started long before that. Her mother, Sherry Rickamoto, was a nurse first, and she passed down her career to her daughter, despite a rebellious phase.
I think it's mostly because my mom was a nurse that I was not going to be a nurse, and my mom had missed so many things. You know, she missed Christmas, she missed New Year's, she missed birthdays. You know, and after I grew up enough to realize that, you know, you can make those things up, it didn't affect who I was. Being a bedside nurse and saving people, like the ICU, made it all worth it. Like, that's what I knew I wanted to do.
In high school, she was already a nurse aide, and took all the hours she could get and worked a lot as well. So, I think both of those things get in your blood.
Mom and I have talked about it, and I think she knew that I had the nursing gene in me, because I didn't play with dolls. I put Band-Aids on them and changed their clothes, and that was about it.
Falk spent time as a traveling nurse, including many years working in an ICU in the Twin Cities. She brought all of her knowledge and skills back to her hometown of Wheaton in 2013, and has been using them to better her community ever since.
This is home. My brother and my sister both live back here, my parents. But my kids are growing up with their cousins and their grandparents and their aunts and uncles, and life is easy here. Takes 5 minutes to pick them up from daycare. I can pop out at noon if they've got a little program going on and, come right back to work.
At work, she thrives, helping her fellow nurses and, most importantly, her patients.
There are times when we're visiting with Chelsie and she's talking about some of the work that she does, and there you can see that it's always the patient is the one that's most important to her. So she's always willing to step up and do what needs to be done to take care of the people that live in the community that she works in, as well as the community that she lives in.
She's always open for us to call her whenever need be, day, night, anytime, and she will come and lend a hand.
When she worked in ICU, she'd talk about some of the cases that were really tough. But yeah, she's just always at it. She's got her heart there for the patients. And I think at the end of the day, even in management, that was always my mantra, was like, what's best for the patient? If every decision you try to make is the best for them, then things turn out pretty good. And she does that.
Falk has been recognized time and time again for her service. There's her Lamp of Knowledge Award for the vast experience she brought to her new role in Wheaton, the Community Service Award for starting the food program, and the Transformational Leadership Award for the way she leads her staff with her actions as much as her words.
Not everybody does just wake up in the middle of the night and go running, and Chelsie and that team, they'll do that.
If we have a trauma right now, I would, leave this interview and I would be hands on deck helping out in there and those kind of things. And so I think leading by example is really important.
Watching her excel, I know what other people think of her. It's one thing to be mom and be proud and really good, but to have those awards, somebody else is also seeing that. So it's very rewarding. You feel like you've done something right yourself too.
In Wheaton, Jason Anschutz, Sanford Health News.